under God,
under God,
indivisible,
indivisible,
with liberty and justice for all.
all.
Thank you. Now, in terms of public comments, have we had anything either on Facebook, or I'm interested to know if we've had any inquiries regarding the hepatitis vaccine in light of the most recent information that was put out about hepatitis vaccine? No. Okay.
No,
Well,
but Sam did post, make a post on Facebook about it,
okay.
which is good.
Yeah. I do watch and I repost everything you post. Because that's another wonderful idea. So, to update a possible resolution to the medical advisor appointment, we have a new medical advisor, right?
Yes, Dr. Nimrod Dayan from Pediatric Health Associates has agreed to be our advisor, and we have everything sorted out with contract and professional liability insurance.
Terrific.
So we're in good shape.
Thank you for the diligence that it took to
That's
make
Sue.
that happen, Sue. I know you really did a great deal, and Joan, and you came in and did a great deal. I think we need to vote him in as our medical advisor, because annually we did that every year for Dr. Kunkel, and I don't think we did it in executive session. I think it was the regular session, was it not, Sue?
You could do it in regular session, yes, that you're
That's what
making
I
the
thought.
appointment, voting and making the appointment for the medical advisor.
Alrighty, so we need,
A motion.
I was going to say we need a motion. So if you would say his name one more time.
Dr. Dayan, D-A-Y-A-N.
Oh, Diane. Okay, so I will entertain a motion from a member of the board to recognize Dr. Diane as our medical advisor for 2026, starting on January 1st.
I'll make a motion.
Thank you, Allison. And a second?
I'll second it.
Thank you, Glenn. And all those in favor?
Aye.
Aye.
Aye. So that motion is unanimous. Thank you very much. That will be a wonderful addition. And when we're in executive session, I'll ask you about the health of our beloved friend. Review the minutes of our November 12th meeting. I did read them through, and I'll give everybody a chance to do the same. I did not find any corrections, but by all means, take a look. I may have missed something. And Taylor, was it helpful getting it off the recording?
It was pretty helpful, but I still have to edit it anyway. So sometimes it's like, maybe it's better if I do it in the moment.
Oh, okay. Understood. Alrighty. So when everyone's finished, I'd be happy to entertain a motion to accept the minutes as written from the November 12th meeting.
I make a motion to accept the minutes.
Deb, thank you. And a second?
A second?
Okay. And all those in favor say aye.
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 Terrific. So, review of our November Health Department activities was very concise, but it's busy. We're busy. But I'll give you the opportunity to let us know what's your highlights.
Sure. I'll do a brief summary, and then Sue can
Sure.
hop on and embellish. As you're aware, we were able to finalize everything for Dr. Dayan to come in as our medical advisor starting on January 1st. And so we're thrilled about that. We'll make plans to meet with him before January 1st to make sure that we have standing orders ready to go at the very beginning of the year. So we're very pleased about that. Flu vaccination season is just about done in terms of our role. And we've, over the course of the whole season, we reached about 859 people and only have a handful of doses left. So it's been remarkable and we're very, very pleased.
Yeah.
In November, we reached an additional 87 people, and that was through both our walk-in clinic and our Board of Education clinic. And then the rest were through appointments because doing more clinics was going to get too chaotic in terms of managing the number of doses we had left. So we went to an appointment basis, and that has worked out very, very well, thanks to Taylor and Sam and everybody. The sanitarian inspections are continuing with just under 100 inspections throughout the month. And, those include consultations for plan reviews, et cetera, and doing direct inspections. And the notices for cosmetology and tobacco establishment renewals has gone out, and several of them have already been coming in. So those are due for the beginning of the year. And then we'll move into food a little bit later. For health education and preparedness, Sue can expand. I think we talked a little bit about the bulletin that went out related to SNAP benefits. I mean, it's just hard to believe that we were in crisis a month ago in relation to people having enough food. We're relieved that the funding for SNAP was resolved, at least, for the interim, but I think it's created a better awareness for everyone how fragile our food safety network is, and that we need to be aware of where our food pantries are and to make sure they're well stocked and helping people to understand what they have access to. So that bulletin was really, really very helpful. And I think Sue mentioned that she's working on our next iteration of an infectious disease plan. So not focused just on flu and COVID-19, but referring to it as a high consequence infectious disease plan so that we're prepared for almost anything. So for example, the DPH is tracking Marburg virus in Ethiopia, and we know how small our globe is now. So we're getting ready to get those plans into place and do the exercises that are required to have us truly prepared. So that's great. We attended the DPH commissioner virtual meeting. It's typically in person, but she had somewhere to go in the afternoon. So it was virtual, and they went over a long list from the Kaiser Family Foundation of all of the executive orders that had been issued since January, and it was related to public health. And it was just stunning and mind-boggling. And I'm going to forward the printout of that from KFF to you, just for reference on how head-spinning these past 10 months have been for everyone in the sector. There's no way to digest it all, but the commissioner went through all of that and gave us somewhat of a picture of what's happening with the Northeast Medical Cooperative, but there wasn't a lot of information in her reference to that. It's still getting on its feet. That's where Connecticut and several other Northeastern states are creating a co-op so that we can have consistency across immunization schedules and sharing data and information, with the CDC being less reliable at this point in time. And they're actively tracking avian flu as well, very, very closely, and Legionella. And then for admin, we think we've found a solution to creating an online portal for permits and licenses. It's not solved yet, but we think we have a solution coming up that won't cost the health team very much money. We have a system in town for another department, and Taylor is working on helping us see what the practicalities are of getting our needs onto that platform and making it work. So we might have something to show off for you in a month or two.
Oh, great.
Forward to that. And then upcoming, is the Hillcrest Middle School Wellness Fair next week on the 17th. And the team is creating a mock septic system with a beautiful gingerbread looking house. It's actually made out of cardboard, and the entire septic system with a mock field, etc. And a big poster explaining it all. So we'll take some good pictures for you and
That's
share
great.
those once they happen. And January is Radon Awareness Month, with the focus week being the last week of the month. And the team has decided to hand out the radon kits that we have. We have quite a few left at the Trumbull Public Library, so that it's a central place where folks can come get them. They can receive some information about how to place the test in their home to be in the proper place to actually check if they have a problem, and to encourage people to bring them back.
Okay.
That tends to be the weak point in radon testing, is people not bringing the kits back for testing. But we're going to work on encouraging people to get them turned back into us. And then there will be a blood drive with the American Red Cross in February, and we'll do some work with, you'll hear more about it in January, but we'll do some work with blood pressure and HbA1cs in February as well. That's all I have. Sue, do you want to add?
I would just like to thank publicly Dr. Mongillo, who was our temporary medical advisor, for assisting us over the past couple of months. He was fabulous to work with, always there, always reaching out. So I want to say a big thank you to him. He was a godsend at a time when we needed him, and looking forward to welcoming Dr. Dion as well. We all know him because our kids have all used him in their practice. So we are delighted to see him come on permanently and begin in January. And thank you to all of the board, the staff, for all the support and helping to get this done.
I did see one thing. I have a question regarding there were you have a few lead cases. And I was wondering, do we know what the source of lead was? Was it like house paint or?
And those are older cases.
Are they? Okay.
Yeah, those are ones that were being followed. Sue, I don't know if
those are from July and September.
Yeah.
So I don't know if you remember whether that was from spices or
I don't think it was spices. That was earlier in the year when we had one related to spices. I think the most recent one was lead paint around the old windows.
Okay,
yeah.
That's when people are have an older home, right? And then they decide to paint and chip it all off and sand it rather than just go over whatever. Okay.
Yeah, and we were on a call today, and they're talking about trying to help teams problem solve the challenge financially with doing proper abatement. That there's some interim solutions that can be used while trying to figure it out. So we'll learn more about that.
Great. All righty. Thank you. Anything else anyone would like to add in terms of the activity report? Taylor, Sue, Sam, anything? Okay. Old business. I don't have any topics here. Does anybody have any questions from old business they would like to bring forward? Anything? Okay, any new business anyone would like to bring forward? Okay, so Glenn, I'm going to put you on the spot. Are you getting a lot of questions about vaccines in your practice? And
there's been, flu vaccine, I think people are still willing to take. The COVID vaccine has been very reluctant for people to take, and trying to convince people to take those has been very challenging. Most of them are done with it and don't want any more. I don't deal with the pediatric population that much, so I don't get too much of the measles stuff. Yeah, but I'm pretty sure New York State has made it still mandatory. I'm not sure what Connecticut is doing, but I know a number of the states are making them mandatory, still suggesting them to be mandatory. I don't know if they can make them mandatory.
COVID or
no, pediatric?
Pediatric, the vaccines for the kids.
Yeah, no,
Right.
Connecticut is still,
Thank you, God.
yeah.
Okay. Thank you. Okay. Anything else that we should sort of be aware of on the vaccine front to anybody that, I've watched the news and, we had the Tylenol and the measles and the Hep B, but is there anything else that we kind of need to be aware of or? Okay, well, I certainly appreciate when you put the correct information on the website and I circulate that and I always try to watch it myself. So thank you. It sounds as if our meeting is over.
Can I ask,
Ready for executive session?
Yeah, can I
Yes.
make one request?
Yes.
Can you just send a new, I don't have the 2016 schedule, 2026 schedule. So if you can send that.
We were gonna approve that, Taylor. Or did we do that last time?
You handed it out last
I wasn't here last
month,
time, so I might have missed
but
it.
it was
Last
paper.
time.
You didn't,
And Glenn wasn't
send it.
there.
I wasn't there, so
Yeah.
I never got the schedule. So if someone can send that to me, that'd be great.
Okay.
I apologize about that, Dr. Rich.
That's okay.
So if we adjourn this meeting, which I'll entertain a motion to adjourn in a moment, then we can go onto the other link for the executive session. Is there anything else anyone needs to bring up in our public session here?
Did we get a link for it, or are we simply going to turn this recording off?
I will look and see if it came.
Yeah, we didn't get a link, but when you make the motion, Nancy or Joan, I guess I'm gonna ask Joan, can you make the motion that Sam, as well as I and Taylor, can go into the executive session?
Absolutely.
Yeah, and he didn't send it. I don't see it, so we need to have Sam. Okay, so we're going to actually.
I don't know if I can make a motion. Am I allowed to make a motion?
Well, Nancy will say.
Yeah, what we have to do is we're going to make two motions. One is that we're going to go into executive session after adjournment, and then we're going to have a motion to adjourn. And when we go into the executive session, that we want to make sure Sam and Sue are able to be in the meeting and Taylor. But I'm a little concerned that we didn't get a link.
Can we stop recording?
Paul, do you have his phone? Can you text him, Sue?
I can, yes.
Would you mind?
I think he didn't think we'd only take 20 minutes.
Yeah. We were fast.
Excuse me, do we need to adjourn the meeting first, like this meeting?
Well, yes, we will, but before I adjourn, I want to make sure that Paul is getting us the link.
We could probably just log back onto this link.
Well, except this link is open to the public. That's the issue.
Oh, I got it. Okay.
Yeah. He needs to send us one that's not an open one.
Did he just say stopped recording? I thought I heard him.
No, it's still recording.
Oh.
And you texted him, Sue?
I did.
Okay, let's see if he responds.
I'm going on mute and I will call him.
Okay. Yeah, I don't want us to all leave until we know there's a plan that's working. The most quiet this group's ever been. Here we all are, nice and quiet, waiting for Sue.
Okay,
he's not picking up.
Oh,
hold on.
I wonder if I can send all of you just a team, I wonder if I can send all of you my own Zoom meeting.
I'm willing to do that. She's talking to somebody. She's got him. 1 minute, she said.
Okay, he's working on it. We should get it within the next minute or two.
Okay. So as soon as we get it, and we know that we've gotten it.
Yeah, so I also forgot that I could have just sent everybody a Zoom link from my work account.
Well, if
Think
all
about
else fails, that will be our backup plan.
Okay.
So what I'm going to do is we're going to have a motion that we go into executive session, that Sam and Sue and Taylor are all included in. And I'm sort of making that motion, and we'll say aye. Then I will entertain a motion for us to adjourn this meeting, and then we will go into executive session. I'm watching my email to see if that has come. And it has not. Sorry, people.
All right. Yeah, I'm just gonna.
You're going to
Sue and
send
Sam,
us.
are you on your work emails?
Yes, I am. Either or is fine with me.
Same.
Okay.
All right. So what's going to happen is we're just going to get a link from you, Joan.
Yeah, but just keep talking, like, because I want to make sure I get everybody.
All right.
So I've got
Okay,
Nancy, Allison, Karen. Oh, I don't have Karen's email. Shoot, how did that happen? Ugh.
It should be on this email that we got.
Yeah, yeah. Keep talking, Nance. You can do it while I get this going.
We still didn't get it from Paul.
Email. I don't have anything from Paul yet.
Doesn't he stay on so that he knows when we're ready?
Bill usually does. I don't know.
Yeah, that's true. Bill does.
You know, it's weird. I can't pull the
email
I can't pull
out.
the participants from this because it's a public. I think everybody was blind copied.
Oh, okay.
Yeah.
Okay.
So I'm going to take it from Taylor's email giving us our packets.
Mm-hmm.
Paul is sending it now.
Oh, he is? Okay. And that's Debbie.
Do you have Gmail for me or AOL?
Who just said that?
Debbie.
Debbie, AOL.
Yeah, see, this came through on Gmail.
Oh, he probably will send it to Gmail then. I was just looking at what Taylor had sent.
Yeah, because I don't know how I ended up with two of them on there.
I can't see where the link was sent to for the meeting.
I know this is cumbersome, everybody, but it's
That's
just the
okay.
town policy that we have to leave our meeting, go into a secure link to go back into this meeting.
Yeah. It's better to do it the right way.
But in the meantime, is everybody ready for the holiday?
Yeah.
Shopping?
No,
Yeah.
not at
No.
all.
Yes, and you have young kids. You should be ready.
You would think I would, but because I have young kids, that's why I'm not ready.
Right.
That was always my problem.
Yeah.
And I also feel like we lost a week. Like Thanksgiving's usually like the fourth week.
It was
And
late.
so we have
Yeah.
a buffer, and it really was the last
It was
week.
late.
And
Yeah.
there we go.
Well,
Yeah,
I usually make each of my grandchildren a quilt, so I have to be ahead of schedule so I can get it to the quilter and everything to get it back. So
Yeah.
I do have that done. And then I have kind of a theme, there's pajamas and, whatever to kind of go with the theme of the quilt.
Mm-hmm.
And Olivia's is a rainbow colors. in Log Cabin, if you're familiar with yes, your mom.
Yes.
So it's rainbow stripes Log Cabin squares.
That's awesome.
And then his is we've been watching the Disney Channel Robin Hood, and let me tell you, that was hard to get Robin Hood stuff because that's out of sync.
Out of fashion, yeah.
But I got a couple of panels, and I put the panel in the middle, and then cut the characters out and put them in stars around the outside. So, and they're quilted with Minky, that soft stuff. So they should enjoy these. And I don't see this email yet.
I don't see it either on my end.
Yeah.
Okay, I'm going to send you guys an invite for a meeting.
Okay, and you got everybody's email?
I got it from Taylor. Sent the packets.
Okay.
Yeah, I just have to add. So hang on. Yeah, go ahead.
We'll make sure that
Nancy, can you and Sue clarify whether we officially adjourn or if we go into executive session before adjournment?
Well, we're supposed to go into executive session and then come back and adjourn, I think. But since we're going to be going to a different Zoom, I think it's okay for us to adjourn this meeting, and then we'll go to the link that you're sending us and have a personal conversation.
I'm going to have to send you a Teams meeting because apparently I don't have a Zoom account.
Okay, I don't know what that is, but you do it the same way as Zoom?
You have to have the Teams app.
I don't think so. I think you can just get on.
So Paul is still struggling, I guess, Sue, huh?
Yeah, I haven't heard from him yet, but he said he was working on it, but I haven't gotten it yet.
I think I might have a private Zoom account.
Oh, really?
Allison, that at least that we know we can get onto.
But you know what? It's on my phone right now, and that's where I'm taking this meeting from. So, I'd have to hang up unless I can. Hold on. Hold on one second. We can figure this out.
Yeah.
We are smart
Technology
people.
is great until it isn't.
Let's see.
I'm sorry we're using everybody's time here. We actually were very efficient and finished quickly. And can you call him one more time? See if he answers.
Yes, I will.
Thanks.
This meeting is being recorded.
That's me.
That's you.
Oh, Allison, you're on here twice.
Hey, I'm gonna get off my phone and try to send an invite to you guys. I know we're getting feedback, sorry. I'll try to send out an invite to everybody on my personal Zoom.
Paul said it's been sent.
Oh.
Did everybody get? I haven't gotten it yet.
No.
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 Nobody else has gotten it?
No. Not yet.
Uh,
Maybe he just sent it to the whole town and not us.
Yeah. No, I did not get it. Taylor, it's very much fun seeing these little heads pop up.
Oh, I'm missing them because I keep going off the
so
screen.
far. Yeah, no.
Oh, there's a head. Hello.
Yeah.
Her mic is off.
Yeah, intentionally.
Yeah. No, it's not. I have not gotten anything.
And it's still recording.
Yeah.
okay, Paul's gonna resend it since none of us have gotten it.
Okay. Says, I am now the host. I just have a little message that says, you are now the host. Ooh,
Oh,
that's scary.
that's nice.
No, maybe it was. Okay.
I wonder if he did that so you could end the meeting and the recording.
Yeah, but I don't know what, it went away. It was a little sign that said, oh, I see, I can end down here, I guess. There's a little X that says end. So when we get this other thing, I guess I can end this. But I have not gotten it. Ooh. And Joan, I'm assuming this needs to be discussed. It can't be something that goes out in an email or a text.
I'm gonna send you an email as a heads up in it.
Okay.
I'm gonna send you an email right now and you'll get the gist of what it's about.
Okay.
But I think we should discuss it too.
Okay. I trust your judgment.
I received a link, but looks like I'm the only one on the email.
Oh, you're the only one on the
Can you forward it to us then?
Yeah, I was just about to ask. I could do that.
Okay.
But Joan, I didn't get yours either.
Yeah, Taylor, you were left
Oh,
off the original email.
I'm still
Doing
putting
it.
mine
So he was
together
sending
to
yours
make sure
Okay.
everyone gets it. Okay, I just sent mine. You should get it in a minute.
Did you send to AOL for me, Joan?
Yes, because I used Taylor's list.
Okay, let me go on my phone and see.
I didn't get that yet either, but it may be because it's my phone is a little slower.
I just got Joan's email.
I didn't yet.
And I did not get Taylor's.
Okay, I just forwarded mine to you guys.
Ooh,
I got Taylor's.
Oh, thank you, Taylor.
I also just got Taylor's.
No, nothing for me.
Okay.
Nope, I didn't get it yet. Oh, Taylor's I got. Okay.
I did too.
You know what?
I'm looking on my phone. I don't have it on my phone.
So does everybody have did Taylor get? Did everyone get Taylor's?
No,
Yes.
Deb, you didn't.
no.
Okay. So Taylor, did you send it to the what one do you want it to? The Gmail or the AOL?
AOL, I sent it.
It's not on my phone at all.
But did you check your spam at all, maybe?
You're unread.
I usually get your stuff though. It doesn't go to.
Did you maybe try closing out the app and restarting it so it'll refresh?
Shut my whole phone, you mean?
Or just go to something else and
Like
come
the
back
app.
to it.
Yeah. Just go out close the app. Make sure the app gets closed entirely and then open the app again.
Okay, me.
Once we know everyone got Taylor's, we will. And I did not get yours, Joan.
No, it's not coming through on my phone. Oh, here it is.
Oh, you got it?
I got it.
Okay. So I'm going to end this meeting because
There's nothing there. I mean, it just has Taylor's name.
Scroll down
did.
and you'll see the forward from Paul Brown, and you scroll down a little more and it'll have the Zoom link.
Oh, we're doing a Zoom with you.
We're
Oh.
going to get back into executive session with this Zoom link that was just sent to us by Taylor. So I'm going to end this meeting, and then we are all going to go into this link that we just got from Taylor.
Okay.
Okie doke?
Yeah.
Yes.
All righty. Oops, if it's letting me.
See you in the other room.